So he served in the intelligence unit of 8200 and has established 3 successful high-tech companies, Comda, Cosign, and Cosign Trust. And he will talk to us about how the electronic signature generates the paperless revolution.
Thank you, Dorit. So do you hear me? It's okay? Do I get this one? Thank you. So, good afternoon, and thank you for arriving to my presentation. I will speak not only on the future, but also on the present, if you allow me. So, and about signing solutions. So, using digital signature, the entire usage of papers become pointless. This is known to everyone. Let's speak a little bit about what is digital signature actually. So digital signature has to actually guarantee to the recipient of certain message or document that the signer is the real signer and the content has not been changed from sending to receiving the document, and also to be able to know the exact time of the signature, okay, by time stamping. So this is what we are doing, and as you will see, it's not only for the banking solutions, but for healthcare, for IoT, for office, it's changing all our lives. So digital signature today is more efficiency, cost saving, time saving, eliminate queues, shorten old school paper dependent processes, environmental positive impact while decreasing the usage of paperwork. Digital signature is already starting the revolution of the way banks operate and change our concept of all banking services. Using digital signature is a key component towards paperless environment, using mobile banking, closing branches, and more security. Digital signature open, realistic, and secure option to mobile banking. The bank will no longer ask the client to make all the way to the branch just to identify him properly. Imagine performing all your banking transaction 24/7 from your mobile device and with biometric identification as well. As a matter of fact, it's already being used, and we are a company that give these services to the banks. They're using tablets if you want to approach the branch, but you can do it also from a mobile. We use tablets, we manufacture special tablets for banking. And speaking about fintech, who doesn't speak about fintech? So the fintech will allow you, using your mobile, with certain fintech applications, to access all the banks on your list. Sometimes you have 2, 3, 4 banks and many companies. So with a certain API, connecting between the mobile with the secured channel, encrypted channel between the mobile and the API, the bank will receive your message and do the transaction. Of course, you need a trusted, and we've heard about trust in the previous panel. So trust is the most important issue. For this, you need, the concept is to have a trusted service provider, not one of the parties involved, not the customer nor the bank, but a third party, identifies the parties and give each party a digital certificate that can be trusted by the bank, and the bank uses the identification to perform all the required transactions. Of course, the certificates will go to the central bank of the country, like in Israel, or the Securities and Exchange Commission in Israel that control the fintech companies. It will be everywhere. In part of the countries, it's already started, and in Israel it will begin soon. So everything here depends on certificates from the TSP, the trusted service provider, that guarantee both to the banks and to the central registrar that this is the identity that over the mobile. From banking, let's move to healthcare. I will try to say a few words about how the healthcare will look like in a few years. So hospitals will be smaller and more specialized. Hospitals will become more user-friendly. Staff members will be reduced. As you can see here, telemedicine will be everywhere. Robots will be more present and visible in allowing food, etc. No need for personnel to do it. Improve non-invasive monitoring. The intensive care unit, maybe we'll have several intensive care units in the hospital, in the modern hospital. Patients will be mobilized early. There will be continuity between hospital and home care. And ethical decision will be openly discussed about end of life, and end of life care will be improved. Today, however, in the present, healthcare system nowadays deals with lots of paperwork. Hospitals, clinics, and private practices needs to deal registration documents, consent for treatment, medical discharge, and many more types of documents. Collecting traditional handwriting signatures from patients at registration and beyond requires the use of paper forms, printing, scanning to electronic medical record, and archiving forms, as well as destroying them at the end of their life cycle, sometimes up to 30 years. So we see printing, signing, scanning, storing, and destroying. Patient information also must be highly secure, readily accessible, stored for years, and comply with government regulatory systems. So here comes again the digital signature that allows the doctor with a single transaction to sign the digital form and automatically send it to all the relevant systems, as I will show you later. Today, we have 4 major healthcare service providers in Israel, all of them using digital signature on prescriptions for many, many years. Patients, physicians, healthcare service providers, pharmacy workflow, all enjoy this and save a lot of time. Highly secured prescription generation and patients' privacy protection, compliant with the healthcare industry standard, and estimated daily saving of at least 30 minutes per physician. I think it's more than 20K annual saving per physician, but I will not argue. This is how it looks like with smart card and some biometric PIN solution that you don't have to remember the password. So this is how it works in Israel. There are many other aspects we've not covered and maybe conflict with the other views. It is difficult to predict the future with any accuracy, and many of these factors such one thing, it's spelling here, one thing is certain, that this future of the modern hospital is a result of highly sophisticated software and hardware systems in every aspect of the hospital 24/7 that have to be highly sophisticated, highly secured, while the doctors, nurses, staff, and patients have to be strongly identified before starting the treatment. And it seems today only PKI and secure digital ID can obtain these standard processes. This is how it should look like, that the nurse preparing the document from the PC or a laptop or something, it goes to a trusted environment, to some tablet or even mobile, while the doctor or the physician sign it, and then it can go to the hospital database, and from there to everywhere, and the pharmacy and to the archive. So to many, as I said before, to many systems. Let's speak about the office usage. Every office still uses a great deal of paperwork, even in 2019. And internal and external usage which to bring the organization to inefficiency and high costs. The average office worker uses 10K of sheets of paper annually. Many of these documents just require signatures from different employees, traditionally handling all that bureaucracy that takes a lot of time. Resources and budgets. By using digital signatures, we can reduce the inefficiency and save cost by at least 85% removing paper-based processes and reduce response time dramatically. This is how it can be used by phone or tablets. And also it does a workflow in the organization which you can move the document from one employee to another, and no more running to complete the entire signing process. Let's move to legal industry. The legal industry relies heavily on vast amounts of documentation throughout the entire life cycle of any matter, from initial client engagement, sending him the client the agreement to be signed, to closing the case. Lawyers today in Israel use the qualified digital signature and significantly reduce the paper usage and time-consuming. The Ministry of Justice, the Court Management, launched the Net HaMishpat system that allows lawyers and judges to send and receive most of the paperwork while using qualified digital signature. Data collected from within signatures clearly shows that 97% of the documents captured within 48 hours and like 83 within 24 hours, which is very good. Let's move to the last subject, which is IoT. IoT is the next great improvement in our daily lives. The main issue is that IoT taking us over by storm is the security matter. By connecting all our things to become vulnerable, while all of our devices and things can be hacked and be used against our wishes. If we speak about the transport systems, if a hacker can take over our car while we are driving and remotely control it, or remotely take over an airplane or a train, these threats must be taken care of before we can even try to start implementing IoT in transformation system. And we've done such project to El Al with the 787. And 2 more slides. Yeah, okay, thank you. In order to establish a real and safe IoT network, we must have high confidence that each device truly what it claims to be. The relevant device has not been compromised. These concerns must be dealt with in order to ensure secure use of IoT. The best way to ensure IoT infrastructure is using digital signature and PKI technology with trusted keys. I emphasize trusted keys. Authenticate every device and everything in IoT network and be sure that it is really the device supposed to be and not compromised. Every piece of software for anything will have to be trusted digital certificate and couldn't be verified. This is part of our solutions of central signing system, mobile verifying identity systems, desktop, laptops, encryption solutions, archive solutions, mobile, and so on. Thank you very much.
Thank you very much. Moving quickly from IoT to IoT.